Well, states now just have 1 month before they have to decide if they will start a health care insurance exchange. These exchanges are a key part of health insurance reform law's efforts to expand the number of Americans with health care coverage. We spoke with the head of the largest health insurer in Florida, Blue Cross Blue Shield. Patrick Garrity is the chairman and CEO of Florida Blue. Pat, thank you for joining us tonight. Will Blue Cross Blue Shield of Florida participate if there is a health exchange in the state of Florida?
Yeah, we absolutely will. We think that we will position our company to be part of any distribution channel that's out there.
How's enrollment been?
Enrollment is not in the exchange yet, but enrollment just in our company, we're over 83,000 new members this year, and we've got over 60,000 new members sold for 1/1 of 13.
How many of those new members have existing health insurance? How many of those are moving from uninsured to insured?
Yeah, almost all of those members had health insurance right now.
Okay.
So we haven't seen the big movement from uninsured to insured happening yet.
In the past 3 years, Florida has been number 3 in the United States among states with the number of uninsured residents. What kind of impact has that had on health premiums for the insured in Florida?
Yeah, it's pretty significant actually, because the health system is required to treat those patients when they come through the emergency rooms, which is typically where they will come. And that uncompensated care ends up being costs that get shifted from the health system to the commercial plans that they have. Right. So it's a fairly significant shift, and we think the system will work better when everyone is covered.
As a percent of an average or median premium that Florida Blue members have, 10% extra that they pay, 20% extra they pay?
I think it's in that range between 10 and 20% that we're talking about additional cost.
The health exchanges, as you well know, are designed with the goal of trying to get more of those uninsured into the market, broaden the market out. If that is successful, if there's more uninsured that go insured, will Florida Blue members see a requisite push down in their premiums, 10 or 20%?
Well, I think that's to be determined, right? Because healthcare costs continue to rise.
Right.
So we're talking about, will that stem the tide of that inflationary cost in healthcare? And there are a lot of other moving pieces here, right? So the Affordable Care Act has new revenue pieces like a tax on insurers, like a tax on device manufacturers. Frankly, we think those aren't exactly helping for affordable care. But then they're offset by having more people in the pool. You know, the net washout of that and what it means for cost is yet to be determined.
The governor of Florida, Republican Rick Scott, has been a very vocal opponent of health insurance reform as written under the current reform law. But a week ago, he sent a letter to the federal government asking for a meeting, writing, quote, "Current information available to us does not offer any indication that an exchange lowers health care costs," end quote. Do you agree?
Well, I think in and of itself, an exchange doesn't necessarily lower cost. The way that an exchange brings people into play is because that's where the federal government subsidies are going to be applied. So you may be eligible for insurance through an exchange, and if you're going to receive a subsidy, then someone who's uninsured receiving a subsidy would bring them into the covered pool. It doesn't necessarily, in and of itself, lower costs to have an exchange.
Patrick, thank you so much. Patrick Garrity along with us, the chairman and CEO of Florida Blue. Well, Florida Blue is a nonprofit health insurer. You can go online to NBR.com tonight to hear more from CEO Garrity on if that is an answer to rising health insurance rates.